It's my pleasure to rise for my party to speak in this important debate. I thank Sandesh Gulhane for bringing it to the Chamber this afternoon, and I move the amendment in my name. Before I move on to the substantive portion of my remarks, I do have to reflect on the Cabinet Secretary's contribution. Had he taken my intervention, presiding officer, I would remind him that every time he tries to lean into the fact that the pandemic is the cause of all of this, a fairy dies. This happens all the time, and he is making not just this chamber angry, the opposition parties in this chamber angry, he is making hardworking NHS staff angry as well, because he is revealing the blinkered nature of his government's attitude to the alarm bells that they have been sounding literally for years, some of which his government has attempted to address through legislation and through other ill-fated strategies. But he cannot keep leaning on the fact that we had a 2-year pandemic when things were demonstrably worse, as they are still now, even before that pandemic, and he needs to reflect on that. It is plain to see, presiding officer, that our NHS is being stretched to beyond breaking point. Patients are being abandoned in waiting rooms, and doctors and nurses left exhausted. What do you mean it's nonsense? I hear from a sedentary position government members saying that people are not being left in waiting rooms, are not being left on hospital gurneys in our A&E departments. They are being abandoned by this government. They are being abandoned by this government.
Sorry, I would very much like to hear contributions in this debate. I would also remind all members to speak through the chair at all times. Continue, thank you.
Well, my apologies for not speaking through the chair on this occasion, presiding officer, but the SNP members know exactly who has abandoned our patients. It is this government, not our hardworking clinicians, who are crying out for help and looking to this chamber for answers. It is estimated that 1 in 7 Scots are now on waiting lists for some kind of treatment. That is a shocking statistic. And everywhere you look, the situation's getting out of control. And that's even before we get into the teeth of what is possibly going to be the hardest winter our NHS has ever faced. And we see backbench MSPs celebrating my tiny improvements in hospital waiting times while we've still got people waiting for hours in pain and in desperation. Over the weekend of September, over one weekend in September, just 63 patients were dealt with within those 4 hours, the 4-hour target. And the availability of child and adolescent mental health services continues to be dire as well. Well, the need for services is illustrated starkly and tragically when a recent study tells us that a quarter of all deaths among 5 to 24-year-olds was from suicide. That is a shocking statistic. And just this week, we saw the worst cancer waiting times on record for the 3rd quarter in a row, with just one health board meeting this government's target. And we know that early diagnosis and treatment is vital to survival in cancer care. Presiding officer, the Royal College of Emergency Medicine has said that waiting time delays have contributed to hundreds of avoidable deaths each year, that those people could still have been alive today. With things this bad, it's frightening to think what it might take for the government to finally get to grips with this crisis. The stakes are incredibly high, and continued failure is just simply not an option. And we mustn't forget the issues at GP surgeries as well. Patients have gotten used to having to wait weeks for an appointment. To illustrate just how bad things are, I want to tell the Chamber of a case I heard about last week. This is the story of a Ukrainian refugee who had to wait so long for a GP appointment, she was forced to travel back to Ukraine to get the medicine that she needed. How shocking is that? And it's not just patients who are suffering. NHS staff are reaching breaking point. Inadequate pay, poor conditions are affecting staff recruitment and retention, while there are currently over 6,000 vacancies in nursing and midwifery alone. That puts huge strain on staff already there. Presiding officer, I want to make, with the very short time I have left, to make 3 suggestions. Take immediate action to address NHS staff recruitment and pay. Adopt the Scottish Liberal Democrat plans for a burnout prevention strategy, and carry out our proposals for more counsellors in schools and a single point of contact with CAMHS waiting lists. We can't wait for this. We have been round the houses on this debate time and time again. It's time that this government listened.